about Adéola Oduwole. Adéola came to Lurie Children's Hospital with more than 18 years of demonstrated experience leading diversity, inclusion, and change management initiatives in large, complex matrix environments. So over the course of Adéola's career, she has established 3 inaugural offices, has been credited with spearheading comprehensive strategic diversity and inclusion plans, and has built the infrastructure and metrics to advance an environment of inclusion in academic medical centers such as the University of Texas MD Anderson Cancer Center, the Frederick Regional Healthcare System, and the University of Texas Medical Branch. So she's also additionally a contributing writer for DiversityCentral.com and an individual recipient of the 2014 Texas Diversity and Leadership Multicultural Leadership Award. So I could say a lot more there, but I wanted to make sure the audience got to know you a little bit, Adéola. So she's going to be presenting, addressing and dismantling institutional racism. So looking forward to this keynote. I'm going to hand the mic over to you, Adéola, to kick us off.
I appreciate that. Thank you so much, Charlene, and good afternoon to everyone. All right, so I am sharing my screen now. And Charlene, if you could please let me know once it's been shared, I'd appreciate that.
I see it now, at full screen and everything.
Awesome, thank you.
I'm not entirely sure if that's the presentation or just your background.
Okay, it's the background, I'm starting it now. All right. All right, so I want to thank Charlene again and also the Opal group for the opportunity to share today and talk to you about what we're doing around dismantling institutional racism. As Charlene mentioned, I have had a lot of experience in this work. I serve as the first chief of Equity, Diversity, and Inclusion at Anna Robert H. Lurie Children's Hospital of Chicago. And one of the things that I wanted to start by sharing is something that our president and our CEO says often, and that is that our institution is more effective in fulfilling its vital mission when people of all colors, ethnicities, identities, abilities, and perspectives work together to create a healthier future for every child. And it was this belief that was really the starting point for the creation of the office. I've been with the institution for just over a year and a half. And during that time, I've learned a lot. What you see on the screen is just a snapshot of some of the experiences that I've had over the course of the 18 years that I've been in this work. And a lot of these institutions were institutions that Charlene had referenced in my bio. Ultimately, you know, when people ask me what I do, I really, you know, just talk about the fact that the work really focuses on shifting culture and changing people's minds and hearts related to this work. And so what I'm going to do over the course of our time together is I'm going to share some of the things that have transpired since the time I joined the institution and some of the things that have really informed our approach to organizational learning. So a little bit about who we are as an institution before we get started. We are one of the top pediatric hospitals in the country. When I joined a year and a half ago, I was extremely excited because for many people in the Chicagoland area, we look at Lurie Children's as being a beacon of hope, especially for medically fragile children. We're a teaching hospital that's affiliated with the Northwestern University Feinberg School of Medicine. We were founded in the 1800s as the first self-governed hospital in the state of Illinois. We have just over 6,000 employees, and a third of that group are nurses. We also are a very millennial organization demographically, and then from an ethnicity, racial standpoint, we are predominantly white. That's interesting to say because we are, you know, located in the city of Chicago, which is very diverse, and our patient and our family population is also culturally and ethnically diverse as well. Just a bit about our vision, again, is to achieve a healthier future for every child. And our work really rests on 4 pillars, and that's care delivery, research, education, and advocacy. And I share this because diversity, equity, and inclusion is inextricably linked to these mission areas. So when I joined the organization, I did a lot of listening and learning and had a lot of conversations with folks. And as a result of the conversations and the collection of several data points, I put together a framework that centers around 4 interlocking domains in terms of what our strategy is to use to guide and advance this work. A lot of our planned focus in the current fiscal year, FY 2021, was really dedicated to the recognition and engagement domain of our pillar. And one of the things that we expressed to our institution that we were going to do was implement mandatory house-wide implicit bias education and training. Then 6 months into my tenure, 2020 was underway. And we all found ourselves at the intersection of multiple pandemics. There was no greater challenge for many healthcare organizations than COVID-19. And COVID-19 amplified a lot of the issues related to health inequity that many in this space were aware of, that has persisted for years, decades. And it further exposed health-related disparities that have also persisted and shed a light on social inequity, structural racism, and systemic racism. And this is what people were marching to and people were protesting about. And for us, what we recognize is that all of these things are connected. The goals of remediating and addressing one means addressing all of the other issues. And so our work really became focused on looking at structural racism, but looking at the intersection of that with healthcare. And it made this work a lot more relevant and important than it's ever been. One of the first things that we did in response to some of the events that transpired in 2020 with the murder of George Floyd and the Black Lives Matter movement was hold what we called a White Coats for Black Lives demonstration. And this is typically held in healthcare organizations as a way to really lift up and recognize the lives that haven't always been understood to matter. Our White Coats for Black Lives event was sponsored, or inspired, that is, by two of our physician leaders. And it was a really profound opportunity for our professional community to stand to support solidarity and empathy as we honored the life of George Floyd, as well as the countless other Black lives that have ended due to racial hatred and injustice. But one of the things that it did for us as an institution is it woke us up, to some of the vestiges of institutionalized racism, structural violence. And this was really the precipice to our call to action, to really ask ourselves, how do we take this momentary and very symbolic moment, but really move beyond that and catalyze what had happened into meaningful results, action, and change. One of the things that we did was we moved forward in July of last year with affirming our strategic plan that consists of those 4 interlocking domains. And then last fall, our executive committee approved an institutional position statement on the impact of structural racism on child and adolescent health. And this was significant for us because it gave us the ability to push for change and transformation at a policy level, but it also primed us as a community to intentionally center our work on members of our employee and patient population who are most impacted by structural and institutionalized racism. We also held courageous conversations on the topic of race. And this was an opportunity for all of our employees to really reflect, share their truths in a psychologically safe environment. We organized our courageous conversations around employee circles that were focused on race. So we had Black employee circles, Asian American employee circles, et cetera. And being able to have these conversations wasn't only about the learning, but it also enabled us to really think about action as well. And a lot of the data and a lot of the feedback that we gleaned from these sessions really helped to inform the development of our organizational learning plan and approach. So what you see on this slide are the competencies that we were going to be teaching as part of this organization-wide learning. And so we call this our EDI learning competency model. And in the innermost layer of this concentric are the competencies that we're going to be teaching as part of this approach. And they're highlighted in blue on the left side of this screen. And these are the competencies that start at the individual and the interpersonal level. And then on the right, you see systems and structures that are highlighted in green. And so the philosophical framework of this model is really going from self, understanding that the work begins at the individual level and then moving to the system. And so what we're communicating is that change management starts at the individual level, and then that's how we then begin to impact the systems level. And so the competencies are defined on the screen as well. And you can see structural competency, which has been a term that's been around for a while. It's a lot more popular within the medical space, but it's actually a new iteration of cultural competency. And this is used to describe the ability of our healthcare providers and our trainees to really begin to appreciate and recognize how broad social, political, and economic structures, in other words, structural racism, has a downstream effect on health and illness. So what we're doing is we're recontextualizing healthcare disparities, but doing so within a broader social, political, and economic structure. And so that when we're interfacing with patients, we're understanding some of those contextual issues and moving away from just focusing on individual factors. Anti-racism is also a competency. And as many of us probably know, it's really about addressing issues of power and privilege along the lines of social identity. It's about acknowledging that yes, racism exists, it is a problem, and really being committed to working towards its end. And it's really about looking at policies and practices and procedures that do not serve people of color and overserve people who are white. So that's the anti-racism competency. And then lastly, conscious inclusion. We understand that inclusion is more than just a feeling, but there are actual behaviors that we can use to demonstrate this and being inclusive in all situations. And I have an asterisk next to this because our focus this fiscal year is really on the first two competencies, and then conscious inclusion is something that we'll begin educating folks with those tools in FY 2022 as we move forward. Now, all of this is set within the context of bias mitigation, and the outermost layer of this concentric, you can see elements of that framework, creating a safe and non-threatening learning context, so a psychologically safe context is important, increasing knowledge around the science of implicit bias, emphasizing how implicit bias influences behaviors and patient outcomes, increasing self-awareness of that bias, and then also improving conscious efforts to overcome it. So we're setting all of this education within the context of bias mitigation. So this is the roadmap. These are the organizational learning phases. And what we decided to do was, instead of using a check the box approach and embarking upon a series of transactional educational events, what we wanted to do was implement a really comprehensive learning framework that was multi-tiered. And for the most part, each phase or each step is connected to the next. So I'm going to quickly walk through the roadmap, and then I'll go into more depth into what each one of these phases are going to look like. So the first phase in the learning journey is really a precursor that kind of sets the stage for the rest of the journey. And the focus is really on historical context of racism in this country. And I'll talk a little bit more about what that looks like on the preceding slides. In phase two, we start with very top, working with our executive and our physician leadership, and actually exposing them to 2 hours of education related to anti-racism. Then there's the third phase, and the third phase is a facilitator certification process that we're currently embarking on right now. In phase four, we deploy the learning to all of our people leaders, anyone who has a manager title and above. And then in the fifth phase, which is what's probably going to happen at the beginning of FY 2022, we implement a baseline climate assessment so that we can measure behavioral change as part of this. And we do that in lockstep with a broader organization-wide rollout to all individual contributors. And so in summary, when we look at this overarching learning journey, it's a blended journey that I'll talk about more. We're using instructor-led as well as, an e-learning format, but it includes, the self-directed learning as well as the in-person learning. And the scope of this journey could really be described as first setting the stage, which is phase one, and introducing folks to structural competency. The second phase, 2 and 4, is really equipping our leaders. So our very top level leadership, our people leaders. Phase 3 is building the internal capacity. And then phase 5 is how do we measure change as we roll this out in a broader context. So we leveraged our learning management system called WeLearn as the most effective pathway for all staff education to really just start to have the conversation, to build awareness about the history of race in this country and introduce the concept of structural competency. And the initial communication actually came out during Black History Month. Our president and CEO sent out a organization-wide memo, and it listed some required mandatory actions. The first phase was exposure to a video series called Race in America, How Did We Get Here? And it consists of 7 micro-sized videos that you can watch sequentially that range from 5 to 9 minutes in length. Now, we were really intentional when we started this conversation to ensure that we were providing pointed education around the history of racism in this country, because for many people, this is a history that has been untold. And if it has been told, it's been told inaccurately, or it was completely omitted. And so it was really about getting very deep, talking about things that were not going to make people comfortable at all, but letting people know that this wasn't about happy work. And historically, diversity, equity, and inclusion education was about happy work. This is really about telling the truth. It's about including the truth, and it's about uncovering the truth. And so that's what the video series was designed to do. So the first segment is really more an introduction to how did we get here. And what it does is it really starts to explore the roots of systemic racism and the way that racism is just continuing to persist. The second video was focused on what we call a system of white rule. And what happens in this video series is that it describes the white rule as a system that was purposely created and maintained to put people in power precisely because of the color of their skin. And so it shows, clips of politicians, judges, and others who actually made white a prerequisite for becoming a citizen, owning or staying on your own land, going to certain schools, buying homes, etc. In part 3, in the Reign of Terror, folks will learn about planned and forced broadcasting of negative stereotypes about people of color. And there's also excerpts of interviews about violence on families of color, including the Trail of Tears, which happened in California, the Black Wall Street massacre in Tulsa, and the 100-year anniversary just happened this year, June 1st. There was also the destruction of Monterey, California Chinese fishing village, and then lynching of African-American people. And part 4, Miseducation, emphasizes the fact that it's very hard to have empathy and appreciation for each other when we don't know what each other has experienced. Phase 5 is called The Past Becomes the Present, and this traces how discrimination of the past shows up in the present within our criminal justice system: housing, voting rights, land use, education, and healthcare. Part 6 is called If It's Still Happening, That Means It's Not in the Past. And it gives examples of how unconscious and unintentional racism can be operating today and how inequities of the past affect current conditions. And then the very last video in the series is the most inspirational one, and it's talking about changing the systems that we've inherited. And so it really reiterates the importance of knowing, again, the full American story. We've got to speak the language that speaks to the issues we're contending with. But starting at that point in order to dismantle those systems is really critical. And again, using the language that speaks to this. And so you can see what, we assigned this to 89 or almost 9,000 people. Our workforce in terms of our hospital paid population is only 6,000 or just over that, but it includes volunteers, it includes contractors, and we've given people until the end of the year to complete it. What some departments are doing is they're watching a video a week as a group, and there's a leadership toolkit that accompanies the video, and it's actually more of a discussion guide that helps people facilitate conversations about the learning. So phase 2 was our executive and physician leadership piece, and during the month of April, we delivered all in-person sessions for all of our department chairs, everyone that reports to the president, as well as our division heads. And one of the key goals of this learning was to really help our leaders leverage their positions to hold each other accountable, but to also recognize that the only way that this education is going to work is if leaders step up and recognize themselves to be the power brokers that they are, and really be committed to making changes as a result of this education. And one of the things that we did at the end of each one of our leadership sessions, and we held a total of 3 in April, is that we asked these leaders to make commitments, in terms of behavioral expectations, things that we could put in place, because it's very powerful when you publicly declare what it is that you want to do. It then makes you more accountable to doing it. But they really need to recognize what their role is in order to make a lot of these things happen. So that was one of the things that we did. The other thing that we did as part of these sessions is that we administered a 17-item retrospective pre and post. And we delivered this survey to everyone using a QR code, and they took it, in person, during the sessions. And you can see what some of the results were. These are just a few of the questions that I cherry picked from the survey. We looked at agreement scale. So we had 5-point Likert items: strongly agreed, strongly disagree. And before the workshop, 50% of the participants felt discomfort or fear of saying the wrong thing when talking about race. After the session, that number was reduced slightly to 30%. Only 36% of our leaders felt confident that they know how to respond to an incident of racism. After the education, that number increased to 72, and almost 100% now understand what it means to be an anti-racist organization, which is up about 33% from before the education. I also wanted to mention that members of our board have expressed an interest in doing this. So even though we have a 68% response rate during the first set of sessions that were set in April, there were some executives that didn't get to attend. They'll be attending with members of our board later on this year. Phase 3 is the capstone of the process for me, and this was really about sustainability and capacity building. In May, we implemented a train the trainer or train the facilitator program to develop and certify a cohort of trainers to facilitate these learning labs as a follow-up to the video series. And this is going to go out to all of our people leaders. As I said, this was a really exciting part of the process because there were 22 internal employees who were so inspirational and just amazing human beings who went through this journey. And for many of them, it was both a personal journey as well as a professional journey. A lot of the key distinctions that they were taught was the importance of practicing inquiry versus advocacy, remaining objective when you're facilitating, and really making the work about the group. And there's a distinction between being a trainer, and there's also a distinction between being a facilitator. And so really excited about this part of the process. A lot of them experienced 16 hours of fully immersive participation or preparation, that is. There was hours of self-study, team practice, content revision. It's also important to mention that the certification happens in lockstep with when we go live. And so to become certified, each one of our 22 facilitators has to co-deliver 2 parts of the curriculum with an expert facilitator, and that's the consulting group that we're partnering with to implement this education. And this is just a snapshot of their faces. I just thought I'd throw this in just so that you could see the demographic diversity as well as the organizational diversity of the folks who are part of this program. These are some of the key learning outcomes. One of the things that we're going to be doing for our people leaders is the 4th learning outcome, and that's learning and practicing skillful allyship. This idea actually came from one of our executive leaders who went through the first iteration, which was only 2 hours in length. And one of the things that they thought would be helpful was some scenario-based learning, such as role play, to teach allyship skills, and incorporating some of that data that was gleaned from the Courageous Conversations has been really helpful. So we actually have real life examples of things that have happened at our hospital that we're integrating into the education, and we're using role play to begin to elevate and educate folks on some of those distinctions. So the 4th phase, I've already talked a little bit to. We went live on May 27th in terms of the actual rollout. These sessions are actually 3 hours in length for all of our people leaders. They'll have a maximum capacity of 25 people and a minimum threshold of at least 10 people per class. And our goal is to teach all 685 of our leaders by the end of our fiscal year, which is August 31st. And so with about 15 to 20 people per class, we have about 40 sessions that have been slated that will help us to reach that goal. And again, we're encouraging our leaders to make sure that they watch the video series, which is really an anti-racism video series, before they engage in that process. Phase 5 is the last phase in our organizational learning framework, and this phase is a twofold phase. The broader rollout is going to happen for all employees, all individual contributors, including our trainees. That will be 2 hours in length. The second phase in the process is measurement, and we're implementing goal-based metrics using the Kirkpatrick model of training evaluation at the onset of deploying the broader rollout. The Kirkpatrick model for analyzing and evaluating training consists of the 4 levels that you see on the screen. Level 1 and level 2 is really looking at reaction. Were people satisfied with the experience? How did they react to the training? Level 2 is, was there increase in awareness or knowledge as a result? Level 3 and level 4 are more longitudinal in nature. And at this level, we're really looking at, is there change in behavior as a result of this intervention? With level 4, really looking at what is the impact on the business, on our organization, whether that's the way we deliver care, whether that's the way that we interact with our colleagues. Level 1 and level 2, very easy to capture, and we capture that data using the retrospective pre and post assessment. And the retrospective pre and post is basically where you capture your pre and post in one sitting. And the reason that we chose to use that model is that a lot of times when you're asking someone a question, and it could be as simple as, I know or I understand what equity and diversity and inclusion mean. A lot of people may already have a preconceived idea about what those things mean. And so they might say before the session that, yes, I actually, do understand what it means. But then when they go through the education, they realize that, wow, they had a completely different frame of reference for understanding that. And so it actually kind of skews, the integrity or the reliability of that pre and a post. So when you use a retrospective pre and post, you're asking before and after at the very same time. That way they're answering those questions using the same frame of reference. And so we implemented that with our executives and our physician leaders, and then we also are going to plan to implement that with the rest of the workforce. But they're very easy data metrics to capture. Research does suggest that learner reaction is a poor indicator of whether or not someone learned anything or whether behaviors are actually going to change. And so you really need to have all of those 4 levels to tell the true story and identify whether improvement has happened or not. So the way that we're addressing level 3 and level 4 is with our baseline climate assessment, as well as pulse surveys that I'll be partnering with our human resources department to implement to measure behavioral change. 4 is really looking at, or level 4 that is really looking at, the results, on the organization. And for us, we know what the baseline is with respect to areas that we need to improve upon. For example, retention across social identity. Right now, there's a bit of a disparity there. We have disparities in our patient and our family experience scores. Overall, they're really great, but when we stratify them by race, ethnicity, and language group, there are some opportunities for improvement. And so those are some examples of some long-term results that we're hoping to inflect change upon as we go about with this educational learning initiative. Here you see our proposed timeline for the broader organization-wide rollout. For the 2 competencies that we're teaching in this fiscal year, you can see what that timeline is, and then also for our individual contributors. I highlighted conscious inclusion because that is a competency that we're going to be teaching in FY 2022. And, the first 2 competencies, are mandatory to be taught for everyone. Conscious inclusion will be offered on a voluntary basis, and we're probably going to be leveraging our LMS system so that we can give folks a guided journey, where we're dripping out education over time and delivering ongoing learning that meets the needs and the schedule of our leaders. And so conscious inclusion will be something that will be dripping across FY 2022. This is what that competency looks like. And so we have identified 5 indicators of conscious inclusion. And then you can see what the behavioral examples are of each one of those different behavioral indicators. And what we hope to do is be able to integrate some of these examples into our behavioral expectations as part of our performance management learning system, and then also use a lot of this to inform the way that we go about screening for candidates and filling positions. And so there's competencies that we can ask related to conscious inclusion that we can use as part of those processes. And so this is how we're going about defining this work, and there is an online tool that we can use to begin to create some education in each one of these 5 areas. Education is essential for any sustainable strategy, but by itself, it's not always sufficient. And so one of the things that we did is we established a governance structure called the President's Council on Equity, Diversity, and Inclusion. And this is chaired by myself and our president and our CEO. And our goal is to really begin to address systems within our organization that may perpetuate bias, hold systemic inequity in place. And really, it's streamlined. You know, when I joined the organization, there were a lot of activity, isolated pockets of activity that were happening across the institution. And the council is one of the ways that we co-lead the work and that we bring all of this work. I kind of think of it as a connective tissue or an incubator of all of the great work that's happening. And so this is an integral part of our approach and our strategy in conjunction with the work that we're doing related to organizational learning. And our goal is to really use this group to establish some accountability, some consistency, and to really look to drive outcomes that are inclusive, that are really centered on folks that have been historically and continue to be marginalized, and make sure that we're measuring a lot of this work and that we're reporting on it transparently. The other thing is that we need to think about education in lockstep with other goals related to hiring, training, promoting, and all of these things have to go hand in hand as we look to shift our workplace. And so this is my final slide, and I really just, you know, I love quotes, and I just wanted to kind of reinforce, you know, the fact that, you know, I titled, or, you know, one of the taglines for this conversation was really, how do we go from moment to movement? And as an organization, we're committed to health equity, and health equity means that we are ensuring that all of our employees, all of our patients, our families have the opportunity to thrive in all aspects of their health, their well-being, regardless of their race, their social identity, their cultural background, and even their zip code, you know. And what really makes this work become more of a movement is having that sustained, steadfast commitment and momentum to this work. You know, a lot of people had a lot of momentum last year, you know, around the same time, you know, we were reading books, and we were, you know, listening to podcasts, and there was a national discourse. But it's really important that we continue to sustain this, close the gap between rhetoric and practice. And that's what this quote really means for us. As I mentioned, our senior leaders have made commitments. We have an institutional body that's holding folks accountable, and we hope to continue to inflect change as we move forward, just keeping those things at the front of our mind. And so that concludes the formal part of this presentation, and I would now like to hear from the audience, you know, and see if there's any questions related to any of the things that I shared this afternoon.
Thank you, Adéola. So I have one question that came in, and we are running close to our time. And that question is from Gary, asking, what role does mentoring have in your long-range goals and objectives? And do ERGs play a part in your DE&I initiatives?
That's a wonderful question, a very timely question. So Juneteenth is coming up next week. And so I just drafted a memo around some of the things that we're going to be doing in order to lift up and honor Juneteenth. And one of those things is we're going to be holding an informational session for the organization that is focused on understanding what are employee resource groups, you know, because there's a lack of education around that. Now, in addition, this memo is going to be introducing a new EDI logo and brand identity for our organization, which I'm super excited about, and it's called Empower All. And so what we're going to be doing is we're drilling down from this overarching identity called Empower All, which is really, really important, especially you know, for groups that have historically been marginalized and don't feel like they can speak up. But we want to create what we're calling empowerment groups. So instead of calling them ERGs, we're calling them empowerment groups. And we just started that journey. So we're starting off by having an informational session. I'm currently a small team, small office, and typically employee resource groups are led by employees. So we felt like, let's create an informational session about this tell folks what this is. We definitely want to focus on race equity as one of our first groups in light of Juneteenth, to really talk about structural racism in healthcare. But then we also want to create opportunities for our LGBTQ plus population, disability inclusion, as well as veterans. So we're really excited about that. Mentoring is also one of the strategic initiatives that are included in our strategy. And there's a special need for that across all echelons within the organization, but also for nursing. 83% of our nurses are white, and over 70% of our patients and families come from ethnic and culturally diverse backgrounds. And so we want to focus on retaining those nurses of color that we do have, and we do have an issue with retaining them. So that group, that ERG group, is the first opportunity to create connection and community, but we also plan to do some more formal mentoring as a result of that.
Thank you, Adéola. What a fantastic answer. When I asked that, I did not know you were going to have so much to share. So we got lucky on that. I love the idea of the empowerment groups. Haven't heard that yet. And it's lovely to hear about new ideas and new ways to kind of, advance that and make sure that it's right on target with what employees are really wanting right now.